and very good evening to everybody. Well, let me just show you certain things today, and I will take you through a journey of fantastic information. If you're here in the live with me, then send your names and send me some highs and hellos. Thank you so much for joining in, and let me just dive in today and let me show you certain facts. Well, give me a second. I will just share my screen with you. All right. So here I go and share my screen. And right now, you will be able to see it very soon. Okay. So I hope this is visible. Can you just imagine what this picture shows? I'm pretty sure that you know it. Well, it is not a meme or a fun photo. This was something back then in the Victorian times when people who had a toothache used to go to barbers, blacksmiths. They were the dental surgeons. So, this is a horrific Victorian photo that reveals a time when getting your teeth fixed was a real life and death procedure. Okay, now, as you can see that from this era where we have gone, and just see the photo, it's a horrifying tooth extraction which is being done, and the patient head is just restrained with the towel that the arrow shows over there, and to stop him screaming in pain. Well, that is unimaginable at this era, correct? Now, this is a fantastic photo which I got from archives, and people used to imagine or they used to think dental caries as demons. So this is an ivory carving, you know, and if you see the intricate art, they call the toothworms as hell's demon. So that was the concept of dentistry or dental caries as such in the back in the 18th century. Now we are in the era where we use microscope to actually see these demons and fight them out. Well, think about the toothbrushes, theirs and ours. If you see these photos on screen, you can see that how the development of toothbrushes has occurred, right from a stick to, I don't know, so many of variations. I mean, this was a very interesting one which I thought I'll put up, that this is an advertisement. See how the first company was Eddie's company, which was eventually renamed Wisdom Toothbrushes in the mid 19th century. So these was the kind of toothbrushes that time. And now we have come to an era where we are using modern toothbrushes, as well as now it is more automatic rather than manual. Well, some more facts. An unexpected discovery. This is a very recent research which revealed, it was by accident. They were studying some kind of prostate cancer, and the scientists stumbled upon uh, to identify a previously unknown set of salivary glands. And this is how we are proceeding day by day into the field of dental sciences, and you can understand from where we began and where we are at this point and where we will be going. Can neem treat oral cancer? Neem, yes, the Indian very popular tree, can be used for treatment for oral cancer. There are certain researches which are happening. So, a very inquisitive question. Another question, if I ask you, is there a new muscle layer on the human jaw? Well, if you are a dental professional or a student of dental sciences, you would be knowing that we talk about masseter muscle, right? One of the most important muscle of chewing. Now, some researchers in Switzerland have discovered a new layer of muscle on our jaw, and they've really found a deeper layer in the masseter muscle. And so, what's the significance of this? I think more research is needed, but why I'm sharing you with these facts, I'll tell you a little later. But just see it is so fascinating. So maybe with with this discovery of the knowledge of a newer layer of deeper layer of masseter muscle, we can rule out many TMD problems, that is temporomandibular disorders. Maybe we can identify or know more about some unknown pain, pain of unknown origin. Very interesting. Well, era of implants. Everybody talks of implants. Even now, patients know about implants. Nobody wants, most of people who can afford do not want to cut their tooth or extract their tooth, but they want a permanent solution. But most of the time we have seen that implants, though it is a fantastic technology, often fails. It falls short of the expectation of people, because sometimes they need to get it replaced 5 to 10 year times. The reason is the local inflammation, that is what we medically call as peri-implantitis. So is it possible to develop an implant that will never fail? Well, again, it's yes, go and search in Google about smart dental implant. This is an implant which has its own power to regenerate bone around it, and it waves off bacteria. That's the simple way I can tell you this information. Can dental stem cells help in tissue regeneration? Do you know what is biobanking? Is it possible that we take out stem cells from our tooth? And I hope many of us know that yes, in teeth we have stem cells which can be converted to any cells. But is it possible to store those cells and help ourselves if we have any degenerative disorder? Well, again, it's a very big industry that is running out there. Can I stop tooth decay before it begins? Again, the answer is yes. Well, this is not my question and not my answer. These are certain facts and questions which I wanted to put up here today to make you understand that where exactly we are moving ahead. And I know that if I ask you this question, does any of these questions or facts tickle your neurons today? Or you might have been reading about them before. I'm pretty sure that the answer from you is definitely a yes. Well, let me go forward and tell you some interesting facts, some more facts, okay? Now we talk about research in dentistry, right? So, can you imagine certain areas of research in dentistry? Okay, let me just do that for you. Today I will, these are just just a bowl of water from the sea. So I'll just tell you 5 areas of potential areas of research in dentistry in a very broad aspect. So it may be clinical research, like for example, I can try to see the erosive potential of different types of food products, beverages, oral healthcare products. So basically here we try to see a wide range of oral diseases. Maybe we try to develop very nice materials or technologies, so that we can apply in clinical practice. Second can be very specific, like biomaterial research. So we all know that how the things have developed, particularly when we talk about aesthetic dentistry, the type of composites it is developing, the shades, the colors, so much and so forth. I don't have to tell. We as dental professionals, and particularly the specialists in it who are aesthetic dentists, they are doing wonders. Another area, fascinating area, can be forensic genetics and bone biology. Well, I know that forensics, when it comes to forensics, is more about studying of dental records in perspective of forensic context. But what about DNA profiling, doing DNA, collecting DNA from just a fallen tooth and just the remains, maybe anthropological studies, even in case of criminal cases, you can confirm the suspect as a criminal. Then let's see another broad area which we call as, say, oral infection and immunity. Herein comes the intricate mechanisms, the molecular genetics, the molecular biology, even understanding the immunological sciences at the immunological level, and maybe, like for example, what could be an example in this area? Say we do endodontic treatments but it fails, so maybe there is some choice of techniques, say for example pyrosequencing, which we can use and understand that what are those bacteria or what are those microbes which are playing foul to just jeopardize our fantastic endodontic treatment, right? Well, another vast area is definitely population and oral health. So maybe the example we say, let us develop a saliva test for COVID-19 detection. So what I'm trying to do is that these are only few examples which I'm putting up. Now, I know that your neurons are triggered. You are triggered. Your mind is wanting that want to know more about fascinating science. But by knowing what I do, how to apply, or where do I get this knowledge, how do I do it myself, whom to approach, what to buy and what not to buy, who are the industry people, if I'm a student, right? Can I do this kind of work? If I am a fresher, am I eligible to go into a pathway which says about so fascinating career? Because I think these are all big people who are doing big work. Well, my dear friends, if you are listening to this video until this point, let me tell you, research is generally said as not a cup of, it's a misconception that it is not a cup of tea for everybody. Anybody can do it. Believe me, anybody can do it. Yes, I understand that there are certain gaps of knowledge, right? And we need to fill those gaps. Okay. Now, if you think that um, I am a clinical practitioner, hardcore dental clinical practitioner, I don't have time to go to a lab or bring in people, talk to molecular experts, and do blah, blah, blah. So, that means, are you away from research? No, my dear friend, you are just not away, but you are not aware. Like, for example, if you just analyze your patient database record, okay, you can find out information about that particular population you are treating in terms of, say, for example, this is just an example, that incidence of a new kind of disease, or incidence of more say incipient caries or early childhood caries, just random examples I'm taking, okay? Because this kind of information is very, very important. And as a practitioner, as a person, you are from science, so as a person in science, if you just list out, make a gist, and you can publish this data, your interpretation, the one help you need is of a statistician, right? You don't need anything extra. You need a computer, an Excel sheet, and a statistician. So, do you think that you cannot contribute to the academic interest of the scientific community? Because I have seen that people say, I might be wrong, you might disagree with me, and I respect that. But I have seen that people say, I am just doing clinical practice. Oh my God, you are doing a wonderful thing. You are not, that is not just. Okay, now bringing all these existing gaps, identifying the constraints, identifying certain difficulties, identifying the different knowledge gaps. I am here today to talk about or tell you about a fantastic solution to all these problems. I know you are waiting, so let me just go. Yes, I am talking about our upcoming online course, a fellowship course in dental genetics and clinical diagnostics. This course will start in August 15, 2022. So, today is the pre launch session, and I just wanted to very honestly tell you to give you an excitement to this area of science, because when we talk about dental research, when we talk about research, we talk genetics, we talk about molecular biology, or any other multidisciplinary areas, we have certain block of thoughts in our mind, which today I want to break the ice. I have shown you different types of facts and questions, so these are all proven research. It is not my words that I have put up. Okay. Now, this fellowship will help you to not become a molecular biologist overnight. It will not help you to become a biomedical scientist overnight. And it will also not allow you to just leave your present clinical practice, or if you are a student or a fresher and you want to pursue higher degree to with your specialty, it's not going to bar you. Rather, this fellowship will empower you to fill your knowledge gap and help you to explore certain other areas which you can make a parallel career, as well as you can take your turn to become a oral healthcare researcher and become and take this as a career opportunity. Well, this is 100% online program, and it will be a mix of self-paced learning and live sessions. Moving forward a little bit more, okay, that was a kind of blinking just to incite you more. So, this fellowship program will be a guided pathway towards the complete understanding of multidisciplinary oral healthcare research career. Through this program, we envision to make you industry ready as potential candidates for clinical research oriented jobs. If you think that there are no jobs, it is wrong. People with this interdisciplinary knowledge is very, very less. There are industry people who want to hire perfectly qualified, or they look forward qualified people, which is missing at this point. I mean, I will not say it is not there, but it is very less. So that is why this point is put up. Then this program will also help you to develop relevant technical skills to apply for national and international calls for various scientific positions. Let me just give you one example where the organization called ICMR from Government of India. They, if I don't know, my dear friends, if you know that they bring out calls for scientists' positions, and there BDS or a MDS graduate is eligible. There are different categories, but I'm just giving you this example. There are certain programs in abroad, it might be kind of diploma programs or even master's program, where you need to make preparations for applications. Now, with this kind of a fellowship program in hand, and with the knowledge that you get through this, it makes you stand out of the crowd. Because if five people are applying to that MSc program or master's program, then you have these skills already in hand. And mostly people like persons with experience, right? So this course will also help you in various ways and tell you how to go step by step to do all those things. Then again, as I said, that this fellowship course will also make you explore a newer prospect of dental sciences, keeping your existing work engagements, because this is an online program. And as I said, that it is a mix of live as well as self-paced learning videos. So it will be a complete package where you don't need to disturb your present engagement if you are engaged anywhere, or if you are running your own clinic, or you are intending to do so. Okay. And definitely, it will help you to gain confidence in approaching and building meaningful collaborations and innovations. As I said in the beginning, that this course will not make you a molecular biologist. It will not make you a biomedical scientist overnight, or in because this is a 6 months duration fellowship course. So in 6 months, you will not become a molecular biologist, and this does not intend to do so. The only why I said this, because the only reason behind is that it is important that the expertises collaborate and come in one place, and then only we do wonderful science. Let me give you a very, very simple example. I gave you an example where I said that let us develop, that's a population and oral health research area, where I said that can we develop a saliva test for COVID-19? Now, if I want to do that, well, I have knowledge of dentistry as my academic background. I also have knowledge of the molecular biology aspects from my academic background. Very good. But still, I don't know how to develop a device. And now, tomorrow, if I want to do that all by myself, my innovation will never happen. It will be just in papers, on papers, correct? So I need to collaborate. So, how to approach somebody who is not from my field, but then I want to talk to them and get their expertise or get collaborated and do this work. So, in this fellowship, apart from the technicalities or the different areas we cover, different aspects of dental research will be covered. I told you five, it will be more than 20, that much I can tell. Okay. So, apart from those technical knowledge, we will also give you a bonus module of in two parts. One where we show you exactly how you take it as a career, as a primary career, if you are interested to do so. Second, if you want to do a collaborative, innovation or a work or even a project, small project of yours, but you want to collaborate, how to communicate with people from science, from a different field, who is not a dental person, who might be a genetic counselor, who might be a molecular biologist, who might be a statistician. So this is very, very important. This communication is very important. All right, so that's a little bit overview of the fellowship, and I hope that you will have questions and we will bring more sessions like this. Do follow me here in YouTube, on Twitter, LinkedIn. I love to write whenever I get time. So follow my LinkedIn. I run a dental genetics overview newsletter where I try to put up interesting stuff. Well, still, I have some information to give you. That's again a flicker for you. This fellowship course is accredited by the American Council of Training and Development USA. So, this is a globally accredited program, and that way, after the completion of a program, you will have a very, very valid certificate which will have the mention of this particular accreditation along with the logo as well, which you can very well use in national and international opportunities in studies or in jobs or wherever. Well, let me just introduce you to the course mentors, the primary course mentors. Why I wrote this, because we will have different other guest mentors as well, and that I will disclose in time. Well, I'll be there definitely, as you know that I'm kind of little passionate about this area, so I'm not going to leave you to share my knowledge. So if you are inside this program, then you have to take my torture. All right. Then we have a fantastic person, Dr. Paul Desmond Sloey, who is the founder and CEO of OSS Diagnostics USA. He is a name in the field of clinical diagnosis in terms of saliva and the adjunct research. And then we will have Dr. Rujuta Patil, where I think there's a mistake in the writing. Sorry for that. And she's the scientific head of Croinas Private Limited, and she is a clinical researcher and periodontist by profession. So, with that, I close this session and thank you very much. And just before closing, I want to say that what exactly is research? I found this photo from Google and I really liked. I just searched who would be the creator of this particular photo. It is so nicely put, and it seems like it's my mind put up there in words. So, research is basically an opportunity where you play with ideas, you earn with ideas, you develop, innovate, you experience, and you grow with curiosity. And that exactly brings you to a different level of the world and experience. So, I think that was all from my side. And thank you so much for joining. And I see few names over here. Uh, uh, Amber Hussein. Thank you, Dr. Ahmed. Dr. Ahmed. Okay, thank you, Dr. Ahmed, for joining. And if you have any questions, you can ask me. But I promise that I'll bring more programs on this, and I'm sure that you will be happy to learn from us, and we are working hard to make your experience a fantastic experience through this fellowship program. So, with that, I will end today. And I think Dr. Rujita Patil has already told here to follow our social media handle. Just a reminder, follow me and my academy in Facebook, LinkedIn, Twitter, YouTube, Instagram, wherever you can find me and follow me. Thank you so much. Thank you and take care. Stay safe. Good night.